Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls today right here in the studio at 866-870-5752. That's 866-870-5752. We're here Saturdays at 10, again at 1 p.m., and when you call the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Check out the website at www.lastemcells.com. That's lastemcells.com, and right now we're speaking with Mike. And
hey, Mike.
Kelly.
Actually, Kelly, that's right. We're actually talking to Kelly. Mike's in the other room, I guess, listening to the radio. So before we get going on this, I just wanted to talk preliminarily about the work that I do. What I do is I take blood from the arm, we spin it, we get platelets out of it, we throw away the red cells because they hurt, and we inject that into areas where there's musculoskeletal issues. That could be joint pain, it could be muscle tears, it could be ligament problems, arthritis, neck pain, back pain, all the way down to the bottom of the feet. And it's something I've been doing for, over 22 years. I started doing it when I was a resident at UCLA, and I've had a great time doing it. The reason I do it is it worked on me, and I've worked on my body. I inject my own body, and it's been great. And I've done mega thousands of patients. I get, maybe 60, 80 new patients a month. I've been told I'm the busiest guy in the world doing this stuff. And I love it. I mean, it's just the most fun of any kind of medical practice I could ever think of, because I get to watch people heal. And it's not a panacea for everything. It may be something that works for you, may not be something that works for you. I have to examine the body first. People they email me MRIs and CT scans and X-rays every day and go, please look at that and tell me if your treatments will work. And I go, I have to touch you. I can't tell from an image. The image means zero. People hate that. I'm sorry. It's just the way it is. Images give false readings. Number one, they don't indicate a pain generator. And number two, they can be, like MRIs, can be overly sensitive. The studies show that they pick up things that aren't even there. A lot of times we'll see things like an ACL rupture. That's a ligament that holds the thigh bone to the leg bone. And we go in to operate, and we find out that it's really there. So I'm not an MRI lover. I do get them just to be safe, make sure there's no cancer or something weird going on. But the way I find out where the pain comes from is using my hands. Make sure, folks, if you're going to get a surgery, that your surgeon has touched the area instead of just using an MRI and saying, you have a problem, look at it. No, they've got to touch it and find it. Those MRIs and other images are wrong a lot of the time. So, Kelly, you're talking about Mike, your husband, and supposedly he's got bone on bone in his low back, L3-4 and L4-5. Is that correct?
And S1.
Yeah.
It's all the way down.
Well,
his back.
Okay. So let me tell you something.
Mm-hmm.
It's what?
He has, first of all, degeneration, and Mike has, he ran the police academy when he was diagnosed with Parkinson's 27 years ago. He's an amazing anomaly, but now he has a hard time moving because of this back, and it radiates. So we're thinking it's sciatica, but it radiates down the left side and partially on the right side, and he's on a scale of 1 to 10, he's a 55 for pain. And so I've taken him, he's got 4 appointments with neurosurgeons because we've done 6 months of spinal decompression and physical therapy, and he's had injections. So hey, we want to talk to you.
Okay. May I ask some questions?
So, yes, please.
Okay. Does he have back pain?
Yes.
Okay. Which is worse, his back pain or his Can I ask some questions?
Yeah.
Okay. Does he have, what's worse, his back pain or his leg pain?
Well, which one's worse, honey? Back or leg? But probably the leg. And he does ice the side of his hip a lot.
Okay. So may I talk a little bit? Can I talk?
Yeah, of course. Please
Okay.
do.
So the side of the hip is not the back, number one. It's the side of the hip is something called the greater trochanter. I want you to look that up. It's part of the femur that kind of sticks out a little bit, and all the butt muscles attached to it. If that is his problem, it has nothing to do with his back. He can have back pain, he can have leg pain, he can have greater trochanteric pain, and they can all be different, three different things. Okay?
Mm-hmm.
Now, I
He
get
holds
people...
his back a lot, his lower back.
He what? He does what?
He holds his back. I'm going to let him tell you. He holds his lower back.
Okay, I don't need to talk to you yet, Mike, because I have more things to tell you guys. So I just need you to listen for a minute. I know there's a lot of information you want to give me, but let's do this piecemeal, a little bit at a time, so it doesn't get confusing. So most important thing, we're talking about your back, we're talking about the side of your hip, and we're talking about your leg. Three different things. Are they related? Maybe yes, maybe no. An MRI won't tell you a thing about if they're related, and an MRI probably won't even tell you if it's the side of the hip that's an issue or not. I have to touch those parts of your body, and move you around and see what's going on. So, so far, what I'm hearing is that the low back is a big problem because he touches it all the time. That's something that we can usually get rid of using platelets or his bone marrow. Okay? Number two, if it's this what you're calling the side of the hip, if it's what I'm thinking, and I have to touch it again, and you have to show me where it is, if it is the greater trochanter, again, that's something we heal using platelets or bone marrow, the stem cells. If it's the leg, I have to see if that's radiating from the low back. And I mentioned this before to another caller. He would need, I wouldn't have him do it now, but after I do the examination, if I think it's called for, I would ask you guys to get an EMG and nerve conduction study to see if that leg issue is coming from his back. There's a lot of leg things that don't come from nerves in the back. And then the most important thing, I want you to get this. You have in your brain that this disc decompression or compression or desiccation or whatever you want to call it, disc disease in L3 and 4 and 4 and 5 and 5 and S1 is a cause of pain. Okay? Right off the bat, I'm going to tell you that's not generally a cause of pain. People can have that and have no back pain at all. So be careful about what you're doing with surgeons here. I'm not saying they're good or bad, but don't jump into a surgery until you see someone who does my kind of work, who knows how to examine it without looking at the images to find out where the pain is being generated from. If you have a surgery based on an image and it's not based on where the pain is coming from, that's going to be a failed surgery. And those surgeries are not easy. Okay? Right. I'm not putting them down. I'm just saying, I had a neurosurgeon on my radio show years ago, and I point blank said, what success do you have doing neck and back surgeries? He said, not even 50%. He was honest. He said before he ever does a neck or back surgery, he makes the patient and the family come in 3 times to talk to him.
Mm-hmm. Well,
to let them know.
Right there. And
it says a lot, yeah. And I wish I knew more guys like that. I don't know any surgeons like that today.
Yeah. Well, we have.
And then I don't know surgeons that get these EMGs and nerve conduction studies. Back in the day, they all did.
An appointment. Yeah, he has an appointment for an EMG on the 24th.
All right, good, very good. So when he gets the results of that, let me know what they say. And those tests are good, but they're about 15% off anyway. So again, the most important thing is touching the parts of the body that hurt, finding out where the pain is being generated from, because the setup here, based on what you've told me, is you've pretty much told me it's a neurological issue that needs surgery. That's pretty much what you've told me, whether you know it or not. And I'm telling you that may not be the case. Maybe, may not be. But you don't want to jump into a surgery that's going to make him worse. Because that's, I'm not going to say what it is, but it's the opposite of heaven.
Yeah. Right.
You get what I'm saying?
He's already having a hard time. Yeah. Nope. This is a God thing that I'm on the phone with you. We had a friend.
I don't know if I can help Mike, but at least I can help you figure out what's going on. And then if you're going to have a surgery, you're doing it, with informed consent and knowing what you're getting into.
Right. We would love.
I mean, I get people like Mike all the time, and I cannot remember the last time, or if I ever have sent somebody to surgery for it.
Yeah.
They all had, they all were on the road to surgery, but I curtailed that.
Yeah.
There's just a lot of other things that might be able to be done. And again, I want to make sure you understand this. This is not a negative statement about surgeons. I love surgeons. They do the hardest work in medicine. Nita and I have a story of a woman that called up, I think a year and a half ago.
Yes.
And she said, Dr. Darrow, she was crying on the radio. She said, what happened to my husband? And I said, what happened? Tell me. She said he had a neck surgery, and he came out on a ventilator. And I said, well, why don't you ask your surgeon what happened? And she said, well, he came out of the surgery into the waiting room where I was and said I did everything right and walked away. And that was their conversation. So she never really found out what happened. And unfortunately, her husband died months later from that surgery.
Yeah.
He had some neck pain. I don't know if the surgery should have been done or shouldn't have been done. I never had a chance to know the man or to use my hands to examine him. But I'm just telling you that most of the surgeries that are done, in my humble opinion, should not be done.
Well, I like what you have to say about touching the human body. I mean, I've worked on skin for 40 years, and I have to touch the skin, and I see how it responds. So I totally, I'm on the same page with the fact that somebody needs to examine my husband, and hopefully it'll be you soon. And, you can actually, explain to us what these connections might be. And we can
and he might be a candidate for surgery. I don't have the answer talking to you on the radio, but the chances are, in my experience, the chances are when people have this kind of a setup, surgery's not the answer. It looks like it's going to be.
We have a neurophysical therapist for Parkinson's. She's awesome. Her name is Claire McLean, and she has said the same thing. The signaling it's not equal to what sciatica usually signals. I mean, we just started working with her that caught my attention, and he does have Parkinson's. So we know the MRI doesn't look good. We know that he was on the SWAT team and he would jump out of helicopters. We know that he got hit head-on in his police car, with a drunk driver.
Yeah.
There are things that we know that could have caused damage, but we just don't know how that relates to what needs to be done. And I like the idea of the body regenerating itself.
That's right. And the thing is that this is a great example of. Mike has had a dramatic life, okay? No question about it. He's got a big story. He could write a book and probably do a movie about it. But that has nothing to do with today.
Yeah.
People come in and they want to tell their stories, and I go, your story's fun, and I love it, but I got to look at where you're at today, because that story may not have created what's going on here, and what's going on here may be something simple, not as dramatic as your story.
Yes, and that's the truth. I agree. So when can
By the
we
way,
see you?
I love SWAT guys. I do.
Well, then you guys.
There's some of my. I like Navy SEALs and SWAT guys and all these characters that are ready to give their life, at the drop of a hat to save people, And
well, that's the thing.
I commend you, Mike.
They need to say so. I want to bring them to see you.
All right.
I'm excited.
The number to the office is 800-300-9300. People can call there right now and talk to someone to get more information than I'm giving out. And then, what you also ought to do with Mike Kelly is to look at my website and watch the videos of me injecting backs. And to get to the website, it's www.lastemcells.com. And, see if it's something that you're interested in checking out. I'm not saying it's going to be the answer for Mike. I have no idea until I touch him. Certainly I have no idea based on what you're telling me. That means nothing to me. Zero. Everything you told me so far means zero. And that doesn't mean I'm putting it down. I'm just saying that doesn't mean that he needs surgery.
Well, on a lighter note, when people would ask me about their skin and their children's skin, I would say I'd have to see them, send them in. I totally am in agreement with you. I understand. But
well,
really
if and when Mike comes, I want you to be there so you can watch the process I go through, so you can understand it.
I take them everywhere, so it's all good. We'll be there. You just tell me when, so I'll call.
I'll tell you when right now. You tell me when you want to come in. I'll look at my calendar and get you in.
Monday.
Or you can Monday? Oh my God.
Monday of which week?
I'll get you in Monday.
Now.
How about Monday at 2:00? Does that work?
We'll be there. 2:00 Monday. We're all yours.
I'm putting in the calendar. I'll send you out some paperwork. Leave your email address. We're going to have your phone number because you called in, but leave your leave your email address with the call screener, and that may mean you may have to call back to do that. And then I'll get that information. I'll set it up with you for Monday. I'll squeeze you in.
Hey, listen. Thank
you
for the work that you do. Thank you.
Oh, well, thank you guys.
Thank you, Kelly.
It's kind of funny because, Mike has put his life on the line physically. I put my life on the line medically because doctors don't like what I do, and
I know.
They badmouth me to all my patients. And then the patients go back to them after they're healed, and the doctor says, well, he didn't do it, it just healed. And I'm like, well, that's fine. A person had something for 20 years, and then in 3 weeks they're better. So, I didn't do it. I'm the black sheep of the medical field, and I've been doing it for a long time. But guess what? I've been teaching it at UCLA for 20 years, and now all my little students are out doing it, and it's becoming something that's getting popular, and it is taking over surgery. Okay? It used to all be surgery. Now regenerative medicine is coming forth, and, some of the surgeons are learning how to do it. You what?
What is the inside of the stem cell that they're using now called? Do you use that?
I don't know what you mean, the inside.
Okay.
I'm not sure what you mean.
I guess they open up the stem cell, and it's a new type of therapy, because when I went into my gal, she was trying to talk into having my...
Well, let me just tell you what's going on. The only thing I am doing is bone marrow stem cell therapy, because the FDA on June 1st came down with their edict that only bone marrow is allowed to be used. It's a bunch of BS as far as I'm concerned, but that's life, and I want to keep my license. I have 3 girls in college right now, so I'm going to follow the rules.
Yeah. I understand. I have 4 daughters. I understand.
Yep.
We'll speak this.
Well, God bless you guys.
Okay.
You seem like great people. And Mike, I cannot wait to get you in the office. I want to hear a lot of your stories. I've been trained by SWAT guys, and I know a lot of them, and we're going to have a good time. Okay?
Yeah, we are. Okay, thank you, and we'll see you on Monday.
See you Monday. Yep.
Thanks. 866-870-5752. And let's go to Joe.
Joe, hang on one second. I'm writing down this Monday meeting I just set up.
Don't forget about that, 2 o'clock.
Yeah, they really put me on the spot there, but I'm glad. I mean, if I can help the guy, I'm so happy.
Of course.
So let me go to Mike here. Let me see what's going on with Mike. So Mike, you're right.
Joe.
He's bothering you.
We're going to Joe first.
Yeah. I apologize. Yeah. Joe, Dr. Marc Darrow, how long has your knee bothered you for?
Since 1992, give or take. But it's
what happened?
Worse lately.
It's been What's that? I didn't hear you.
Can you hear me?
I can hear you. You can scream at me.
Okay.
You're not going to hurt my feelings.
Okay. Basically, it's been an ongoing thing since probably 1990, 1992. And
Yep.
I just kept it going by exercising, light weights on the bench, pushing out. But lately it's been getting pretty bad. So I have an X-ray from 2015 where it looks pretty bad. I was talking to my doctor, and he was looking at the X-ray, and he goes, well, listen, this is what we can do. I can refer you to the surgeon, and, well, you know what's going to happen there, but they don't play around. Let me know when you're ready, and I just refer you.
Okay. Have you been to anybody who
said.
can tell you what's going on? Did they tell you it's arthritis? Because an X-ray pretty much is only going to show the bones and show the cartilage loss. So is that what's going on? He told you have arthritis?
Quite a bit of, I'm sorry for talking over you. I apologize.
No problem. Go ahead. Tell me.
It shows quite a bit of worn on one side. It's pretty bad on one side. It's missing quite a bit of cartilage on the right side, on the lateral side. Okay.
Can you walk around?
Yes, I can, but obvious. It's not obvious. I can walk, but obviously I limp, and at the same time it's somewhat disfigured or twisted.
Yeah. Okay.
Like a.
I'd have to see it, Joe. I'd have to see it and touch it and move it, and look with my ultrasound inside. I use an ultrasound to look inside the joints to see what's going on. Have you ever had steroid shots, cortisone?
Yes, many times. Not cortisone.
The problem with that is
cortisone
not cortisone. Yeah.
Cortisone
okay. Cortisone destroys the cartilage, so stay away from that. You probably have had hyaluronic acid injections, which don't really do anything. It's a lubricant, but your knee is probably all filled with hyaluronic acid already. So I don't see that as any kind of a long-term help for you. But I need to get my hands on that knee, see what's going on, look with the ultrasound, and see if I can help you. I don't know if I can fix it.
Sir.
Yeah, I don't know if I can fix it so you're brand new. Probably not if it's all worn away, but probably get you better than you're at right now. And we would use probably stem cells on a knee like that. We'd probably just bypass just PRP and use bone marrow. God bless you all. Thank you, Nita Valens. I want folks to go to my website, which is www.lastemcells.com. Call the office if you like at 800-300-9300. And you can take it from there, Nita. God bless you.
Okay. Well, thank you. And thank you, Alex. Thank you, Suzette. And listen to our pal Warren Eckstein on the Pet Show from 11 to 1 every Saturday. And I'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.